The rotator cuff is a group of 4 muscles that surround the shoulder. It is the natural aging process of the rotator cuff to begin to tear or fray or begin to fail as we get older.
The younger population, if they're going to tear the rotator cuff, usually it's a more of a traumatic event where they have a pulling type injury to the shoulder and end up with a rotator cuff tear from that.
Younger patients with an acute injury, we found that relatively early repairs are most successful, so we do like to be a little bit more aggressive with those patients.
The ultimate goal of any rotator cuff repair is to have a patient return to full prior levels of function. Usually patients are in a sling for up to 6 weeks after surgery. You are starting physical therapy during that 6-week time with just some gentle range of motion, and then progressing to strengthening as the rotator cuff heals. Ultimately, it can take up to 6 months or longer to heal from a rotator cuff repair.
Older elderly patients with a degenerative rotator cuff tear we found do really well with non-operative treatment. A lot of those patients are going to have a return to near normal function, very minimal pain, and an ability to have a good quality of life without surgery. Because we know a lot of those tears may be asymptomatic long term, we want to try to be conservative with those. So physical therapy, rarely injections, activity modification for a short time before the full function and compensation can take over.
Our motto is basically let's try the most conservative approach first. If indeed it does ultimately require surgery, we do feel that we've got all the highest level surgeons to get people back to the best results and to the activities they are interested in doing.